Okay. Good afternoon, everyone. Thank you for being here. My name is Paul Larkin. I am a Clinical Education Associate at Pure Encapsulations, and I will be moderating today's webinar. Today is a very exciting webinar. We have not one, but two experts with us today, Doctors Caroline Cederquist and Felice Gersh. We're going to be breaking this up into kind of a two-part webinar. We're going to hear from both experts, their approaches, their thoughts, and then at the end of the webinar, we will have time for a Q&A, so you can ask individual questions, you can ask for the thoughts of both experts, so it should be really exciting. Allow me to introduce our speakers. Dr. Caroline Cederquist is the founder and medical director of the Cederquist Medical Wellness Center in Naples, Florida, which is a comprehensive weight management and preventative medicine clinic. Her scientific understanding of medical weight management through proper nutrition has allowed her to help patients all over the world. We also are joined today by Dr. Felice Gersh, a board-certified OBGYN and medical director of the Integrative Medical Group of Irvine, California. Dr. Gersh is one of just a small number of fellowship-trained integrative gynecologists, and we are very lucky to have both of them here with us today. Before we get started, I would like to just quickly mention that you can download the slides for today's talk by following the link that I have entered into the chat window, so feel free to download the slides, mark them up, do as you please. And this is, again, a live webinar, so we will have time at the end of the talk for a Q&A. So you can submit your questions either in the chat window or the Q&A window. And if you'd like, you can address them to either Dr. Cederquist, Dr. Gersh, or both. So with all that said, please join me in welcoming our first speaker for today, Dr. Caroline Cederquist.
Hello. Hi.
I can hear you. You sound great. Go ahead.
Yes. And I'm like, oh, I need to get the slides up. Sorry about that. All right. Excellent. So in terms of speakers disclosure, we are both paid advisors to Pure Encapsulations. You guys can read the details later. What I wanted to talk about just briefly, my background. I'm a family doctor, and more than close to 30 years ago, when I started practicing family medicine, I quickly realized that so many of my patients had medical issues due to their weight. I found I was writing multiple prescriptions for high blood pressure medicines and triplicate, and asked my patients, if you lost 30 pounds, this would be better. No one ever said, I want to be 30 pounds overweight. So I decided more than 20 years ago to create a comprehensive weight management center. But I didn't want to rely on diet pills or very low-calorie diets like the powdered, just nothing but shakes that was kind of being utilized at the time. So we really worked with dietary changes, accountability, looking into the psychological factors, and that was really my start. I didn't start as a functional medicine doctor, but when you work with weight management, you become functional medicine because you find out that people have symptoms like food allergies, issues with GI health. And a big thing that really came up clearly very early on, and we developed over time, was realizing that insulin resistance was very highly prevalent in my practice, and treating it comprehensively has been the cornerstone of my medical practice. What I found out very early on is I had many, many patients who were women who experienced weight gain with menopause, or maybe they were always overweight but then really gained with menopause, or never overweight and gained with menopause. So this really became a real specialty of mine. But to be clear, when most patients enter my practice, one of the overlying things they want to do is lose weight. So the way my practice works is patients are seen by a medical staff member, that's me or one of my physician assistants. We take their history comprehensively, do labs, and the people who agree to work with us commit to work with us for 3 months, where we see them usually weekly. Doesn't always work out that way, but we're really focusing on dietary changes, lifestyle modifications, correction of metabolic issues, and nutritional deficiencies. Many of our patients continue with us after the 3 months, and many have been in my practice for 5 years, 10 years, 20 years. the ones who stay that long really find that we're treating them with some sort of functional medicine approach, and they keep coming back or remain in our care because we are able to help them with things that other doctors can't. So to get back to insulin resistance, again, the cornerstone of my medical practice, we find that for many people who struggle with weight, the numbers are very, very high, men and women, but insulin resistance is present. And for the majority of women, weight gain with menopause is common. On average, 15 to 30 pounds, although it could even be more. And, the classical medical text had said the weight gain is due to, being less active and eating more as you enter midlife. But when I did laboratory evaluation, I found that 90% of the women in my practice had laboratory evidence of insulin resistance, and I'll share exactly what I'm looking at when I say that. But very much so with women who would say, I felt like a switch had been flipped and I all of a sudden gained 10 pounds. It was like a different metabolism had taken over. I've always watched my weight. I was always careful. I don't have any control anymore, and I'm so frustrated. Again, people sometimes are willing to say, I'm not eating well, it's my fault. But when it feels out of their control, they get very, very frustrated and scared. So what I look at on the right, if you wouldn't mind starting there, my evaluation is kind of simple. We do labs that are commonly done at something like Quest or LabCorp, a complete blood count, a comprehensive metabolic profile. We're looking for the glucose, the liver functions. I have been checking fasting serum insulin levels for more than 20 years and find them very helpful. Hemoglobin A1C for about 15 years, and that really was a game changer with these women with weight gain with menopause, because I will find that the hemoglobin A1C will go up much sooner than any elevation in glucose, insulin, but even sometimes triglycerides, but often the elevated A1C and triglycerides do go along together once it's been present long enough. The lipid profile, of course, looking for a low HDL and a high triglyceride. We always check thyroid function, and some very pointed nutrients, vitamin B12, vitamin D, magnesium RBC, and recently we started testing zinc and copper because we're really interested in how that affects cognition, but it also does help with insulin resistance. And what we really work on is making sure that our patients have adequate protein and controlling the carbohydrates in their diet, primarily limiting the sugars, making sure that they don't have vitamin deficiencies. If they're present, we correct them. Getting our patients to move. And some of my patients are a lot older, they can't do a lot, but getting them to move is a secondary. Changing their diet is the primary. And then again, a big key to my practice is really working on the glucose homeostasis. So with regards to protein, I do recommend a prescribed amount. And again, we allow carbohydrates, but we're looking more at vegetables, lower starches, 2 fruits a day, not no fruits, but really reining in the carbohydrates. And we do have a relatively low-fat diet because our diet is low in calories, but we do want the healthy fats as part of our diet. With regards to protein, we do calculate protein requirements based on how tall a woman is and her amount of fat-free mass or lean muscle tissue. But roughly, most women will fall into somewhere between 100 and 120 grams of protein per day for weight loss. And that translates to 25 to 30 grams of lean protein with every meal. Now, sometimes people say, what does that mean, 25 to 30 grams of lean protein? About 4 ounces of chicken, 4 ounces of fish, 1 egg, and 3 egg whites will give us 25 to 30 grams of lean protein. We do, get this extra protein by making sure that we have some snacks throughout the day, which could be something like a protein shake. It could be 2 cheese sticks or something like that. And to be clear, this amount of protein that we use in our weight loss process is higher than the RDA for protein, which would recommend about 54 grams of protein for a 150-pound person. But we have found that when we hit these protein targets, our patients lose fat while maintaining muscle mass. And we do body composition analysis to make sure that that's happening. And we find that that's really key, maintaining muscle mass in the process of mobilizing body fat and improving glucose homeostasis. Some of the favorite products that I use to help myself with this is a supplement called PureLean Ultra. This supplement has 25 grams of vegetarian protein and some good metabolic cofactors that support healthy weight management, but only 170 calories. What was really important to me as Pure Encapsulations and I worked to create this is it has to taste good. There's so many protein powders out there, and of course, you know, there's no artificial sweeteners. That's, of course, a platform of Pure Encapsulations. But, you know, we need it to taste good. You know, there's a lot of protein powders out there, especially when you go to vegetarian blends, that are, you know, pretty rough to get down. With the PureLean fiber, this particular product is really helpful in terms of helping people feel full, helping with satiety. I usually recommend people to have a scoop as they come home from work, as they're trying to get dinner prepared so that they can not overeat. And an important thing about our meals is we usually do 3 meals, usually a snack mid-afternoon, so that people don't enter dinner too hungry. With regards to checking micronutrients, we do know that obesity is closely associated with lower plasma concentration of certain vitamins. The D, of course, is huge. We find that all the time. I'm finding zinc low all the time, magnesium low all the time. So, you know, we look for this, and I like to get my patients on a good quality multivitamin. I do like the PureLean nutrients. It tends to be a very well tolerated multivitamin as they work through their process, but sometimes we'll be adding additional D or additional magnesium depending upon their needs. Past the macro and the micronutrients, we do have some help with some nutraceuticals that can help us with some metabolic gene targets. We have learned that AMP kinase and SRT1 assist in the process of glucose uptake, and the things that help activate these gene targets are calorie restriction, certain bioactive nutrients and plant metabolites, and exercise. And I say, let's use all of it, because our patients need all of that. So some of the things that help promote the AMP kinase and SRT1 is resveratrol. In a recent study, placebo-controlled, resveratrol helps support healthy insulin signaling and antioxidant defenses. And then one of my big favorites, berberine, enhances the expression and function of insulin receptors. In a randomized placebo-controlled trial, including 116 subjects, berberine provided statistically significant support for glucose, lipid, and triglyceride metabolism, and we do see that clinically. So one of my favorite products is Metabolic Extra. You'll see here that it has 350 milligrams of berberine per capsule. It does have alpha-lipoic acid, also very helpful, glucose homeostasis, and resveratrol. I have patients start with 1 capsule a day just because some people have some GI issues with berberine, especially if they have some dysbiosis. But we eventually want to get people up to 3 a day, sometimes more, 4 a day, 5 a day, 6 a day. And we see significant improvements with this supplement. And it does tend to be very well tolerated. Getting back to exercise, you know, we do know that this helps patients, but it is really key that people understand that while exercise helps you in every aspect of health, except if you overdo it and hurt yourself, what is going to mobilize weight is changing your diet. So we focus on that and then get our patients to start moving. There is some good evidence that high-intensity interval training might help glycemic control better than continuous exercise, but a lot of my patients are not in the position to be healthy enough to do HIIT. You know, you have to be pretty fit to really push yourself. We get our patients walking and try to do something consistent every day, use a fitness tracker, and it helps. With regards to the PureLean Healthy Weight Management Protocol, you can get this from Pure Encapsulations. It shows the Metabolic Extra, some of the favorite supplements that we utilize, PureLean Fiber. We find that it really just is a nice adjunct to helping people lose weight. My book is called The MD Factor, and that is available on Amazon. And if you wanted to get some information about the best and leanest protein meals, you can log on to www.mdfactorbook.com. So in summary, our treatment process for weight management looks at all of these with a real stress on improving insulin sensitivity. We do get into sleep, we do get into detoxification. You know, we will look at the genetic SNPs, you know, for our patients who are interested in doing so, but really making sure our patients lower their simple sugars, support their fat-free mass with adequate lean protein, correct the deficiencies, makes all the difference in terms of being able to move forward when metabolism has been very stuck. And at this point, I am going to pass things over to Felice.
Hi, thank you so much. I'm sure that you all are wondering what I can add here after that wonderful presentation by Dr. Cederquist. So let me tell you just a little bit about me, and then you'll see why I have just a slightly different approach. I am one of those rare breeds. I'm an integrative gynecologist, so I look at everything that has to do with women's health. And I'm out here always on the path trying to educate on the amazing functions and role that estrogen, that primary hormone of femininity, that we lose when our ovaries start to go into, we'll say, senescence with the onset of menopause, and the tremendous impact that the loss of peripheral estrogen production has on women's health. In my practice, I have a little bit different approach because my patients don't usually come to me predominantly for weight loss. They come to me with other symptoms often related to hormonal imbalances and other things related to the unique issues of women's health. So I look at menopause, the universal issue that every single woman will face, from a unique sort of metabolic issue type of a condition. So I look at menopause not so much for the weight issue, which I look at as a side effect, but rather the incredible metabolic, we'll say, hurdles that women have to overcome. And as Dr. Cederquist mentioned, that most of her patients, when they get into menopause, they gain an amazing amount of weight, even though they're doing the same things. They may have been exercising, eating what was, you know, generally considered a healthy diet, and yet these pounds just piled on, and they didn't just pile on, they piled on in areas that normally they didn't, like around the middle, around the midriff, the belly area. And of course, this is very distressing. So I see this weight gain as a phenomenal issue in women. I see it as a symptom of estrogen deficiency, whether women head into menopause at age 45 or 55. It's not the number of years lived, it's the deficiency of estrogen, which ensues with the onset of menopause. And then its relationship to these amazing sort of functions that are embedded in us. For example, the circadian rhythm, which we now know is an estrogen-controlled issue of health. And the gastrointestinal system, of course, the microbiome, that invisible civilization that resides within our guts, that actually acts as the control center of all of our metabolic well-being. And then, of course, it leads into weight management, because every woman wants to have a body that she feels proud of. And this all involves, in my view, everything metabolic. For estrogen, as you'll come to see, is the master of metabolic homeostasis. Traditionally, estrogen has been viewed as a hormone solely involved in reproductive functions. But if we look back, way back, we're talking millions of years ago, estrogen existed in creatures that had nothing to do with reproduction the way humans do. It was all about metabolic health and control. So what is metabolism? Metabolism is like the life force. It's about everything controlling energy, the production of energy, the creation of energy, and how energy is distributed through the body, ultimately for the purpose of reproductive function and survival. And of course, the reproductive functions with estrogen in mammals is an added-on feature. So as we can see very quickly, metabolism is essential for health. It's the life force. And to have a healthy reproductive woman, you need to have a healthy metabolism. So it's all interconnected. So estrogen, it turns out, is supportive of a wide array of physiologic functions in the female. If we look at this list, we'll see that it parallels a lot of the things that Dr. Cedarquist was talking about. For number one on the list is the issue of insulin sensitivity and glucose homeostasis. So estrogen is about everything with insulin, and we know that when you have high levels of insulin, when you have insulin resistance, you are going to gain weight, because that's what insulin is about. It's about producing and supporting fat in the body, of course, among many other things. And when you have high persistent levels of insulin, you can't lose weight. And one of the reasons, as Dr. Cedarquist emphasized, is that insulin resistance and glucose problems will lead to weight gain. And women in menopause inherently develop this problem because estrogen deficiency is the problem here. Estrogen deficiency, when you have that situation, will reverse the insulin sensitivity that estrogen supports. And the gut microbiome, that area that is so critical now that we understand is so important for every aspect of health. And adiponectin, that is a hormone produced by fat cells, which promotes fat burning, and estrogen supports that. So obviously the opposite is when you don't have enough estrogen, you're going to lose that support. You're going to lose the body's ability to properly burn fat. And estrogen moderates the appetite. And of course that makes sense, because everything about appetite is about controlling energy input into the body, right? And estrogen supports sleep, which we now know is very important to maintaining a healthy body weight. If you have problems with sleep, you will gain weight. And once again, we're back to the same things that Dr. Cedarquist discussed, the AMP kinase and the SIRT1, those really critically important cellular sensors and enzymes. The SIRT1 is the enzyme, and the AMP kinase is a sensor of nutrient status. These are critical in maintaining metabolic health, maintaining circadian rhythm, and maintaining weight. Estrogen receptors are located throughout the entire body, because once again, you wouldn't want a woman reproducing who has an unhealthy body. And estrogen is like the miracle coordinator of all the functions in all of these organs. And so, of course, when you lose the estrogen production from the ovaries, you start to have metabolic dysfunction, because all of these organs are needed to function together to create metabolic homeostasis. And if we go down the list, we can see mitochondria. As Dr. Cedarquist mentioned, women after menopause seem to gain weight, and it's been traditionally discussed as, well, they move less and they eat more. Well, why would they do that? Why are they suddenly hitting menopause and they're suddenly eating more and moving less? Well, one of the reasons is, if we look at the top, actually, the central nervous system, that is what controls appetite in the hypothalamus. That is a function controlled by estrogen. We now know that, for example, women who have binge eating disorder, when treated with estrogen, actually improve, because the appetite control centers of the brain are estrogen regulated. And also mitochondria, which are involved in burning fat and making energy. As we know, we age, and some people look at aging as mitochondrial defects and deficiencies and so on, that you don't make as much energy, you're going to be tired. So part of aging is actually estrogen deficiency, leading to appetite dysregulation and fatigue. So if we look at this slide, we see the estrogen actions and what happens as a result of estrogen deficiency. And it also says resistance. So for example, endocrine disruptors, those ubiquitous chemicals that we live with, like bisphenol A and phthalates and so on, and heavy metals, they can induce obesity because they block estrogen receptors. So if we look here with the brain and then down the fat, the pancreas, the liver, muscle, and that bottom cell is a white blood cell, because in fact the immune system is also controlled by estrogen. When we have everything in order and we have actual physiologic levels of estrogen circulating in the female body, all of these things are working in perfect harmony, and you have metabolic homeostasis. We have proper production of energy, we have proper insulin sensitivity, we have proper immune health, and proper energy balance. But once we get into a deficiency state, look at it, obesity, obesity. You can go on down the line, insulin resistance, and we know insulin resistance leads to obesity. So it's clear, absolutely 100% incontrovertible, that when you have estrogen deficiency, you're going to have metabolic dysfunction, and that leads to ultimately weight gain. And so once again, I see weight gain in menopause as both a problem in itself, which needs to be addressed, but also as a sign and symptom of metabolic dysfunction, and we need to address all of those things as well. So in my clinical model, where I see women of all ages, and particularly in the menopausal transition years and thereafter, I look at what's going on with their estrogen and their circadian rhythm and their gut microbiome, and the effects that all of these things have on metabolic dysfunction and ultimately on their weight. So once again, we can see the body changes as we see the young woman going into the heavy-set woman, that we've all seen women with all of these body types, that it's a manifestation of metabolic dysfunction and of all the things that we've talked about. If we go to the bottom on this list, it says circadian rhythm. That has been the focus now after the Nobel Prize was given to the discoverers of clock genes. The circadian rhythm has really become a very important focus, as it should be, because circadian rhythm is critical to everything about metabolic health. So circadian rhythm is the beautiful, I see it as a romantic thing, where we have all life forms on Earth have evolved to live on Earth. And the fact that we have day and night creates differences in every part of our bodies. Our metabolisms are totally different in the day and in the night. And we have a master clock in our brain sitting atop the optic nerve called the suprachiasmatic nucleus that actually can see light and dark, and then gives this information throughout the body to all the cells to help them work in beautiful synchrony to create metabolic homeostasis. And every single cell in our body has peripheral clocks, including the microbiome. Every single cell has its own clocks, and they all have to work together so that we have this unified function of the body, so that we have metabolic homeostasis, proper appetite, proper insulin control, and cortisol. Everyone knows that there's a circadian rhythm of cortisol. It turns out that often women who have in menopause have a flip circadian rhythm of cortisol, which as well creates significant metabolic issues. And what are the different circadian rhythm disruptors? Well, we know that too much light exposure at night, poor meal timing, where people are eating randomly or eating very late at night, poor sleep, high levels of stress, travel across time zones, true jet lag, working at night. We know that women who work at night, for example, nurses, have much higher rates of obesity and diabetes, and I'll show you a little study in a moment. And of course, I mentioned endocrine disruptors, and of course, menopause is a huge issue for causing circadian rhythm dysfunction. Here is a study that shows, look at this, when only 8 days have passed where people have lived with a flip circadian rhythm, they're turning 12 noon into 12 midnight for 8 days. Look at what happened to insulin. Insulin rose 22%, which goes along with everything that Dr. Cedarquist and I have been saying, that when you have high levels of insulin, when you have insulin resistance, you're going to gain weight. So when you have disruption of your circadian rhythm, which includes menopause, you're going to have insulin resistance. It is inevitable. So every woman, I want you to know this without, if you, as a major takeaway from today, that every woman entering menopause is inherently going to develop insulin resistance. Just as Dr. Cedarquist noticed in her own practice, this is a given. So we need to do everything to help to support them so that they don't develop diabetes, prediabetes, obesity, and all the other sequelae of having insulin resistance. As I mentioned, the gut microbiome is really key to metabolic health. It turns out that it's a bidirectional situation. The gut microbiome has its own clocks, and it can help set the liver's clocks and help set the whole body's clocks. But also, when we have a disrupted circadian rhythm, we will disrupt the gut microbiome's own clocks. So it's very important to eat at the right time, to eat consistently in terms of timing, not to do crazy different timing on the weekend, and to try to nourish and really love our microbiome. We need to take care of it so it can actually, in turn, take care of us. When we have the wrong gut microbiome, it becomes pro-inflammatory. It reduces the production of short-chain fatty acids like butyrate, which are so key to maintaining health. And we get what is called leaky gut, disrupted intestinal barrier function, which leads to endotoxemia and ultimately inflammation. So once again, it's bidirectional. Inflammation drives obesity, and obesity drives the production of more inflammation. So it's like a downward spiral. And all of these factors come into play to create inflammation. And now we know inflammation is at the root cause of virtually every problem that can occur in the human body. And you can take a look at this slide later because it really shows the bidirectionality of obesity and leaky gut. So when you have a leaky gut, which can occur from any of many sources, but certainly when you lose estrogen, we know this has been shown that women going into menopause, they get an altered gut microbiome, which leads to inflammation, which leads to the wrong bacteria living within the gut, which leads to poor barrier function and leaky gut. And you have then produced in the gut microbiome, by the gut microbiome, these toxic particles called lipopolysaccharides or endotoxin, which can leak out into the systemic circulation and create just systemic inflammation and produce more obesity. And it affects the liver, creating fatty liver, which in turn creates more problems. Insulin resistance and triglycerides are poured out, and skeletal muscle can also get fatty and develop insulin resistance, the fat tissue, the pancreas. So take a look at this later, and you'll see how this is all driving obesity, and it's all linked to estrogen deficiency, effects on the microbiome, and of course, once again, it links back to the circadian rhythm. So my approach is a little bit different. I focus a lot on healing the gut microbiome and trying to get the circadian rhythm to be as physiologic as possible as my first step in trying to help women lose weight. So, what I tell them is don't even think about the weight for about 3 months or so. This is a short-term approach, 3 to 6 months maximum. Don't think about your weight. Let's just focus on metabolic well-being. The weight will come off of its own, right? That'll be like a benefit, a side effect. But let's focus on getting your gut microbiome and your circadian rhythm back on track. So as a short-term approach, I look at giving a very high fiber diet. And I use actually a lot of the same supplements and so on, as you'll see, as Dr. Cederquist does. But my focus is let's get that gut microbiome healthy, and then everything will come back on track. So I give, like I mentioned, a very high fiber diet. So where do you get fiber? Well, you get it from plants. So I'm very pro-plant. I love a plant-based diet, but including all of the colors of the rainbow of plants, including the fibrous plants, the ones that have starch, because these are starches that feed and nourish the microbiome because the bacteria use starch as their food, right? So they ferment it. And so I feed them, I nourish them, I cater to their needs, and I give them lots of complex but carbohydrates. Remember, these are always complex. None of these are simple carbohydrates. There's no processed food in my diet. There's no sugars. There's no high fructose corn syrup. These are whole foods. So we're talking about tubers, root vegetables, and whole grains that are not turned into pancakes or commercial cereals, so they have to be whole grains. And so this turns out to be a low-protein diet in the short term, but I don't in any way restrict plant protein. So they can have beans and lentils and nuts and seeds. So it's a very high plant-based diet. And I avoid animal protein, but once again, this is short term because when you have an abnormal gut microbiome, it doesn't metabolize animal protein properly. It can make some toxins like TMAO, and it can combine with nitrates to create nitrosamines, which are carcinogens. So I avoid most animal products short term while I'm nurturing the gut microbiome. Additionally, I look at meal timing. I do time-restricted eating. You probably know the American diet is one of eating around the clock. So we do not want to do that. We want to have a nice fast at night and to stop eating by around 7, 8 at the latest, but even as a goal to stop eating about 7 p.m. because we know all the organs of the body are on timers. Everything is timed, and our pancreas likes to go to bed around 7 to 8 at night. And if you eat after that point, you're actually stressing your pancreas, the beta cells, and we do not need that in women who are already having problems with insulin resistance. So I like to have an early dinner, timed eating, try to eat the same time every day. That helps keep the beat. We want to keep the beat for circadian health. Eat fewer meals if you can, but when you do need to have snacks, try to keep them timed. And in the very beginning, I promote eating more healthy fats like olives. You know, if people love olives, I say, and they don't have a problem with the salt in it, to try to eat olives or a little bit of nuts like pecans and macadamia nuts, which have a lot of healthy fats, or a little bit of avocado. And to try to space out your meals so that dinner and breakfast are 11 or 12 hours apart. And I'm a big advocate of fasting, and we can't really go into that here for time, but taking a break from eating, either with the fasting mimicking diet that was developed at USC's Longevity Institute, or actually doing a water fast under supervision for a very few days, 3, 4 days, 5 at the most, can be beneficial. And there's been plenty of data now showing it can really help with both weight and metabolic health. And look how we're the same, Dr. Cederquist and I. We both love the same supplements. Let me move back here. So we have resveratrol, lipoic acid, berberine. Those are all wonderful. They are actually fasting mimetics. They actually create the same benefit in the body as does fasting. So I use them all the time. They're wonderful tools. And exercise. It turns out that exercise is good for everything. It actually promotes a diverse, healthy gut microbiome, and it actually is like a reboot to the circadian clock. So definitely exercise is the universal solution to so much. So everyone should get on an exercise program. I totally agree with Dr. Cederquist that you don't want to push things too hard, right? We don't want to have injuries. So I start out very gently as well. I just get up and move, do walking. Walking, there's so much data on the benefits of that. And then hormones, that's a whole separate topic. I'm a big hormone advocate. I believe that most women can benefit from hormones. I see it as only a piece of the puzzle. So I look at life and health as like a 1,000-piece jigsaw puzzle, and hormones are in the center. They're about 400 pieces of the puzzle. The other 600 pieces require everything else that we've talked about. If you only give hormones, like you run a hormone clinic, which I don't, I run a health center, I don't just give out hormones, that you are going to miss the boat. So giving hormones, we can never recreate, even by trying to do sort of the sort of more outlier type rhythmic hormones. We can never truly replicate the hormone production of a healthy 25-year-old woman. It's not possible. So we have to use these other tools because we can't recreate the ovaries. It's just not going to happen. But estrogen can be helpful. And gut health is very important, avoiding endocrine disruptors. We have a whole gut microbiome called the estrobolome, just designed to detoxify estrogen, and we must nurture that, and that's what I've been talking about, using prebiotics, probiotics, and fiber as part of a healthy diet plan at every stage. And I have, of course, my own protocol as well, and it actually overlaps so much with Dr. Cederquist. We both love Metabolic Extra, and I'll let you go through it. What I want to show you is one of my special products that I actually developed, which is Menaviv, which helps with hot flashes, but it has a lot of gut support, because you already know I'm very big on gut support. It has in it lignans, which are phytoestrogens that actually have been shown to really help to maintain gut homeostasis. It helps with the gut itself, and that in turn, of course, helps with everything else in the body, including hot flashes. I very much emphasize sleep, because sleep is so critical, and so I use some melatonin, I use sleep solution. I give a little dose of melatonin several hours, 4 to 6 hours before bedtime. That helps to reset the circadian clock, helps to prepare the body for sleep, and it also is wonderful for getting the person mentally prepared for sleep. Looking at a sunset is also a wonderful thing. We know that melatonin is very key to both gut health, to the circadian rhythm, and it's a very potent antioxidant, and with age, melatonin production does decline. I'm a big fan of curcumin. I think that's like if there's any herb that's going to be on your list, it should be curcumin. And to maintain gut health, I use GI Fortify because it has so many wonderful things to support the microbiome. And of course, probiotics, magnesium, everyone is deficient in magnesium. It involves over 300 functions in the body. And so, of course, magnesium is always on my list. And I use the Woman's Pure Pack, which includes all of the other wonderful things that you need to ensure that the nutrient status of your patients will be met. So my summary is very similar to Dr. Cederquist. I just add in what I call the missing ingredient, because this is my love and my passion, is to educate on the role, the critical role played by estrogen in women's bodies and the real impact of loss of ovarian estrogen production and what that means for all of the functions of the body, which are all metabolic functions, because once again, metabolism is the life force of life. And we must maintain a healthy metabolic state. And when women gain weight in menopause, which is close to universal, it is a sign of metabolic dysfunction. So I tackle the weight, but I tackle it through my metabolic approaches, through maintaining a healthy gut microbiota and working to maintain a healthy circadian rhythm.
I'd like to thank our speakers, both of our speakers, Dr. Caroline Cederquist and Dr. Felice Gersh. Thank you so much for this talk, and thank you for sticking around to answer as many questions as you did. And also like to thank all of our attendees for taking the time out of their afternoon to join us today. Thank you all so much for being here. This concludes our webinar.